If you have gestational diabetes, you know that you must eat the right amount of healthy foods and keep active to control your blood sugar. For most women with gestational diabetes, these lifestyle changes will be all that is needed to help control their blood sugar. A few weeks after making changes to your diet and increasing your physical activity, your blood sugar will be tested again. If your blood sugar is still not controlled despite these changes, you may need further treatment. Based on your condition and personal circumstances, your doctor may prescribe you metformin tablets or insulin injections. Many women worry about their friends' and family's reactions when they are diagnosed with gestational diabetes, especially if they have to give themselves injections.
They ask themselves, what happened? How did I get it? And how will I come out of this? They get confused, most of them. They say, what? I don't know what exactly to do.
You should know that you are not alone. 1 in 10 pregnant women have gestational diabetes. It is not your fault, and there is nothing to be ashamed of. And you should not feel that you have to hide your treatment.
Exercise, eat healthy.
A part of your body called your pancreas makes something called insulin, which keeps the sugar in your blood at safe levels. But sometimes, changes to your body during pregnancy means that you are unable to use the insulin properly. Because of this, your body needs more insulin. You may be prescribed insulin injections to help control your blood sugar. There are different types of insulin in terms of how fast they work and how long they last. Your doctor will prescribe the right one by considering your age, your lifestyle, and how your body responds to the medication. For most women taking insulin, this means giving yourself injections every day before breakfast and sometimes also before other meals too. The insulin should be kept cool, ideally in the lower part of the fridge, or if that is not possible, in a pot with cold water. Store insulin away from direct sunlight. Take care that the insulin does not get too warm or too cold or frozen. If the insulin is ever frozen, it should be discarded. To inject insulin, first, you must wash your hands thoroughly. Use a needle and syringe like this one. Ideally, inject yourself in the upper arm or thigh. Injecting insulin does not usually hurt. The tip should never come in contact with anything other than freshly cleaned skin. Quickly inject just below the skin. Take the needle out and apply a small amount of pressure on the spot, and never squeeze blood out. While you are taking insulin, you must regularly test your blood sugar. Your doctor or nurse will tell you how often you must do this test. For the test, you simply insert a test strip into the device. Then you prick a clean fingertip with a special needle to get a drop of blood. Carefully touch the test strip with this finger and wait for a blood glucose reading to appear on the screen. It might seem overwhelming at first, but you'll soon get used to it. Watch out for signs of low blood sugar levels, also known as hypoglycemia. This is particularly important if you are taking insulin. Symptoms include shaky hands, sweating, trembles, headache, mood changes, irritability, and a tingling sensation around the mouth. Severe symptoms include confusion, strange behavior, and anxiety. If you feel any of these symptoms, you should take 3 to 4 teaspoons or 15 grams of glucose powder dissolved in a glass of water. If glucose is not available, take one of the following: 3 to 4 teaspoons of sugar dissolved in a glass of water, a small glass of fruit juice, 3 to 4 teaspoons of honey. If this happens before a meal, treat the low sugar and then eat your meal. If your next meal is more than 1 hour away, treat the low sugar and then have any snack that is available at home, such as a chapati, fruit, or a glass of milk. It is sensible to keep something sweet to eat with you at all times, such as glucose tablets or some sugar, biscuits, or a soda, just in case you suffer from low blood sugar when you're away from home. Instead of insulin injections, you might be prescribed tablets called metformin to take each day. These tablets reduce the amount of sugar released in your blood, and they also help your body to use insulin better. Your doctor or nurse will tell you how much to take. It is best to take the tablet during or after a meal. It is normal to feel anxious about taking tablets, but know that they are perfectly safe for your baby and for you. Most women have no problems taking metformin. Some women have side effects from these tablets, such as feel like vomiting or stomach pain. Usually, these side effects get better after the first week. Tell your doctor if these problems continue. Taking your medication correctly will make it less likely that your baby will suffer as a result of your gestational diabetes. Sometimes, women with gestational diabetes need to have both metformin tablets and insulin injections to keep their blood sugar under control. Even if you have tablets to take or insulin injections, it is important to continue to eat healthy and take exercise as well. Even if you are feeling good, you should visit your doctor regularly and keep all your appointments. Your doctor or nurse will work closely with you to find the best way to treat your gestational diabetes. For some women, this will mean taking daily tablets or giving themselves injections. Getting your blood sugar under control will keep you and your baby healthy.